All right, so Wisconsin has 236,097 children under the age of 5 who need childcare. And only 161,657 licensed seats. That's a gap of nearly 75,000 children. And infant seats are the most scarcest of all. And I took up 2 of those. So for the families who do find a seat, price is staggering. Full-time infant care now averages $17,400 a year in centers and 22% of the median household income and $13,000 in family programs. That's more than UW tuition. Childcare is becoming a luxury not everyone can afford, and for many families, the seat doesn't exist anymore. So, as childcare in Wisconsin is becoming a luxury good, especially for the missing middle, families who earn too much for Wisconsin shares but still can't afford care, what's your plan for them?
Thank you so much for that. And this hits personally for me. My youngest daughter is 6 years old. And when she was in daycare, it cost us $1,500 a month. My mortgage was only $1,000. So we're paying more than my mortgage to send our child to childcare. And then when she turned 5 years old, she qualified for a K-4. We didn't qualify for Head Start, so we had to actually pay for it, and that cost us $1,000. And so me and my wife, we had to have a conversation whether or not she was going to stay at home or go back to work. And I was joking with 2 of the ladies that she wanted to go back to work, and she said she needed more adults in her life. And I understand that because this is not just about our children, but it's also about the mental health of parents as well. And so we need to make sure that childcare is universal across the board for every child under the age of 5. We can cap the payments at 7% across the entire state. But I also believe that K-4 needs to also be universal, because that's an extremely important age before any of our children actually enter the school system. And so I am proposing that we have universal childcare for every child under the age of 5. And many of you may say, well, how do we make sure that we have the bodies for that? And that's by investing upstream, making sure that we have enough childcare workers, we have enough centers, by making the upfront investment in the first place.
In order to fund a universal childcare program that is sustainable, we have to look at employer contributions. Our plan is both a small payroll tax with upfront costs covered by the segregated fund, and there are multiple trusts that I believe that the upfront costs we can use borrowed funds for that. And while I agree that universal 4K and fully funding our public schools must come with that, I do know that there is a tension right now in which the 4-year-olds who are at our child care centers, the cost for care for 4-year-olds is much lower than it is for infant care. And I have seen the Coalition for Public School Education advocates and our child care advocates come together, but we know the system very much works to pit these communities against one another at times. So it's imperative that we look at sustainable, continuing direct provider payments that are flexible, investing in a universal program for families who are that is fully subsidized for families making up to 400% of the federal poverty level. And this 400% is because right now for a family of 4, that's about $130,000 a year. So it does have to go up to about 400% FPL. And then beyond that payroll tax, of course, childcare being infrastructure, it's imperative that we use the tax exemptions that we have been providing to corporations. I'm so sorry, yes, we can still tax the billionaires and fund childcare.
The most expensive year of our lives was the year that my husband and I had my 2 stepdaughters in college. We had a senior and a freshman, and we had a baby. And yes, that is crazy. We paid more for 1 baby in daycare than for 2 kids in college. And we were delighted to do so. Thank you very much. To solve the provider shortage, you have to raise wages. But to solve the affordability portion for parents, we need to make Wisconsin shares universal. And the reason that's the smartest path for doing that is because the feds are covering a huge chunk of that, right? Roughly 60%. So why would we ever leave free money on the table? Now, for the state portion, yes, of course, we can increase our revenue by restoring some of the pre-Walker taxes and increasing taxes on multimillionaires and billionaires. We should absolutely do that. We should end subsidies for data centers. But my favorite plan is to get baked for babies, get stoned for shorties. It's about taking that revenue that we're going to get from legalizing weed and pouring it into early childhood so that people can really feel good about what that money is going to. And the other thing that we have to do is address infant care, and that's about universal paid family leave, because there is no care for the youngest babies. And every single person in the state, regardless of the job that you have, should be able to get that paid family and medical leave so that whether you're in an accident, whether you have a new baby, you do not have to risk your rent or your job.
So,
Mandela Barnes.
yeah, thank you so much. So the benefits cliff, it shows itself across the board in many different ways. I think about the fact that we haven't expanded healthcare here in Wisconsin, one of 10 states that has yet to expand our Medicaid program under the Affordable Care Act. And you consider the folks who are trapped between 100 and 133% of poverty who do not qualify for Badger care. I mean, even honestly, if you were above 133%, it's still difficult because that is not a whole lot of money. And people are making the unfortunate decision to go without health insurance simply because you just don't have the extra income to be able to afford it and be able to save for an emergency at the same time. This is the same thing that's happening right now with parents, with families who aren't able to afford childcare because of that benefit cliff, essentially. And what we need to do, of course, is broaden availability and eligibility for Wisconsin shares. But we can go back to that funding conversation we talked before. I wish I came up with some cool euphemisms like Kelda did, but the fact remains clear. There's so much money that we have left on the table. States like Minnesota, Illinois, and Michigan have taken advantage of. They've been able to do good things for their children with those additional resources, and it is important. It is paramount that Wisconsin does not leave a single dollar on the table when it comes to improving quality of life, especially for our young people when it matters the most.
Thank you. First of all, this doesn't start when they're infants. There are 26 counties in Wisconsin that don't have a practicing OBGYN in them. Like, this is not an issue that just starts after birth. It is everything, and all of these things are related. And, and here in Madison, it's closer to $30,000 for infant care than it is the average that you talked about. So these are issues that are a problem everywhere in Wisconsin. So, capping it, you said it was 22%, capping that at 7% is one of the ways that we do that, ensuring that we increase eligibility around Wisconsin shares, increasing reimbursement. Those are all things that we can do. And there are resources that are available to do it. And every resource question is connected. I'm going to talk about corrections. In the state of Minnesota, a state that is roughly the same size as Wisconsin and has the same crime rate, they spend about $213 per capita on criminal justice and prisons in Minnesota. We spend in Wisconsin about $313. That's $100 per capita that we spend extra. You add that you multiply that by the population of Wisconsin, that's $600 million that we could be spending on this part instead of what we're doing to house people when we haven't dealt with them, when we haven't invested along the way. Like, these are the things that we can do in Wisconsin that show the Wisconsin values. That's where we get resources, but it also is the smart thing to do economically too, because it pays dividends for us over the course of the entire lifetime.
Thank you to all for those answers. I'd like to welcome up Jenny Maurer, Executive Director of the Wisconsin Head Start Association, for our next questions.